Western Spring Television. Ours it is.
Yes, good afternoon, viewers at home. You're welcome to your darling program, Spring Clinic, where you have an opportunity to have first-hand expert and proven knowledge concerning your health. It's exciting that this is coming from Western Spring Television, channels 190, start time, where we're going to, we will be coming up with information, knowledge that can help us, guide us to seek correct help that can help us. There's a popular saying that says that knowledge is power. I have seen people lose their lives. I've seen people mismanaged because of the fact that they didn't have the correct access to doctors that should help them. They possibly were referred to the wrong places, or some people don't even have an idea that some kind of doctors are available that could handle some of the programs, some of the problems they have. So this is why this program is quite exciting. And in Nigeria, I can tell you that there is no expert anybody is looking for anywhere in the world that we don't have in Nigeria and in Oshogo as I speak. And that is why I want our viewers to please take this program quite seriously. There's a lot of information that will be coming up from time to time where issues concerning our health, our well-being is going to be shared. And that, of course, beyond that, we can also be properly guided. Somebody can have all the monies in the world and is not properly guided about how to shop for your health care. And that is why we have this program here. Today, I'm excited because I have an expert in the house, a distinguished surgeon, somebody who has spent a lot of time studying about the urinary tract. That's a big word. What I mean by urinary tract is that starting from our kidney down to the pipes that goes to our bladder where we urinate. Disorders, there could be a lot of things that can go wrong with that and that may require surgical intervention. Apart from that, this specialist also deals with the genital tract of men. A lot of us hear a lot of things about our prostate gland. And at midlife, a lot of people are actually scared about what is happening to their prostate. Today, we are going to have an opportunity of meeting an expert who is going to speak authoritatively on this particular subject. And I have the pleasure of introducing to us Dr. Ojewuyi Olufemi. He's a consultant urologist with Uni-Osun Teaching Hospital, and he's also a lecturer at the Department of Surgery, Uni-Osun. So you're welcome, Dr. Ojewuyi, to this program.
Thank you very much.
It's quite exciting because the issue of prostate and all of that is something that a lot of men are scared of once they hit midlife. And I wouldn't blame them because possibly they've lost an uncle, they've lost a friend to CFG prostate. And most people do, there are a lot of questions in their mind. Please, is there something that can be done? Is there some form of information that we need to have that can help us about this? And it's amazing that for the women, I think they have their own doctors, yes, especially when it comes to the genital tract.
Exactly.
Men don't know that we also have specialists like you dealing with the genital tract of men. We hear of the gynecologist who deals with the genital tract of women, the uterus, the fallopian tubes, the vagina, the vulva, and all of that. But for men, most men are just they are not just aware that their genital tract also has a specialist like you. Please, can you tell us briefly about this, your field? Because you're a consultant urologist. Please, can you briefly tell us what it's all about?
Thank you very much. It's nice to be here this afternoon to discuss about issues that has to do with the urinary tract and the male reproductive system. When we talk about the urinary tract, which is within the confines of what a specialist urologist deals with, we are talking about the kidney, where the urine is produced to start with, and then from there down to the ureter, down to the bladder, down to the urethra. Generally, that talks about the urinary tract, and then that's both in males and females. Every male, every female has things that I've mentioned generally. But now coming down to the male reproductive system, which is the other aspect that the urologist deals with, that includes the prostate gland, which is the most common thing that anybody in this gland will probably have heard of. And then we talk about the male genitals generally, the testicles, the penis, the scrotum, and so on. These are things that a urologist deals with, either in the context of male infertilities, for example. Infertility can be due to male factors.
Excuse me, but in our culture, it's not compatible. Most times when there's infertility, it's the woman.
And that's exactly why I'm bringing this up, because 20 to 30% of causes of infertility are seen in males, 20 to 30% in females, and the rest, they both share it. But unfortunately, we live in a climate where the entire body is placed.
How can a man be infertile, especially when he's having erection? I mean, because that's quite a bit disturbing to most people. We go to family meetings and say it's the woman that is the problem.
Yes,
and of course, because I have an erection, some people say they've been able to impregnate people in the past. They may not be able to substantiate that.
Exactly.
So it's a bit disturbing to hear that a male can be infertile.
Yes.
Despite the fact that he has an erection.
Yes. So, I mean, that the man has an erection does not necessarily mean that same person ejaculates, that is, produces semen, does not mean there is any sperm, any egg in that semen. So
in that semen?
Yes.
And yet he ejaculates something out.
And yet he's able to ejaculate. The semen is not just about the egg alone. That we have fluids, it's made up of fluids that nourishes the egg. So there may not be egg there at all. And there are several reasons why there may not be egg there.
I think these are the important point to start with. So what could make somebody who has an erection ejaculate something out, and you're telling us here now, sir, that that person is not enough, that's not enough to father a child?
Okay, so the process of fertility in male has to do with three major factors. There are factors that are higher up in the brain. There are hormones that needs to be produced that will now stimulate the testicles. Those are the balls. Okay. The testicles are the ones that will produce the sperm cells. And so if there is a problem with the hormones that are still high up, then there may be problems with fertility.
Because some folks can actually have problems high up.
Yes.
That regulates the stimulation of the testicles to produce the correct ingredients.
Yes.
Okay.
The testicles themselves may have undergone some assault at some point in the lifetime of a man. That is what we call mumps.
Okay, mumps or otitis.
Otitis.
Okay, when the testicle has some infection.
In childhood. That also, or infections generally.
Or even trauma. Some people who play footballs or have an accident that involves the testicles.
That involves the testicles.
It could actually affect its fertility.
Yes, so the testicles could have undergone that assault over time. There is what we call testicular torsion too, in which the cord that anchors the testis twists, and then it can cut off the blood supply to the testes. And we see that a lot in teenagers. And by the time they come to the hospital, they've gone somewhere, they've given analgesics. By the time they come, the testis is gone already.
What causes that torsion? Is it accidental? Is it mechanical?
Oftentimes, there are factors that the child is born with. We call them congenital factors.
Okay.
So over time, there may be recurrent pain in the testicles. And if nothing is done to it, as time goes on, that pain, that sudden cut off of blood supply may eventually lead to permanent damage to the testicles.
So it's interesting to know that there are a lot of conditions, even in the male, that could actually predispose the union to infertility.
Yes, sir.
Not necessarily the women.
Not necessarily.
Because we keep hearing the gynecologist talking to us. We don't hear you people. Why is it like that? Is it your culture that is silencing you people, or we don't have many of you around?
Well, maybe compared to gynecologists, we are not as many as, I mean, the entire urologist in Nigeria is not of 300 to serve a population of, I mean, right from childhood, there may be conditions that requires the services of a urologist, adults. And then prostate itself is a big deal. I mean, it's a disease of public health importance.
Absolutely.
In countries where where policy formulations are well regulated and well implemented, it's a disease of public health importance, like communicable diseases. Yes.
Really?
Yes.
Why is it like that, please?
Because, I mean, the moment you are approaching the age of 50, it's almost certain that at some point you have symptoms of prostatic illness.
Why is it that my prostate will begin to give me problem at 50? I mean, because I've always had it. I've always had my prostate.
Yes.
And then why
every
is it
newborn
that,
child has a prostate gland. Every male has a prostate
so
gland.
why is it not becoming problematic when I'm 50?
It increases with age.
Why?
The size.
Why?
The size increases
Is it
with
some
age.
hormonal changes or what is
Yes.
responsible for that?
Hormonal changes. Hormonal changes. You approach puberty, testosterone comes up,
Okay.
and then after puberty, testosterone is still needed to maintain that sexual male habitus in men. So as long as there is testosterone, there will be increase in size of the prostate.
There's this off-the-record knowledge that people who are more sexually active don't have prostate gland problems. Is it true?
It is not true. Again, it is not true. I mean, I've seen patients who have many wives who ejaculate as often as possible. They come down with prostate issues.
So it's a rumor.
And so I've seen those who are in quote now celibacy, or let me say
Who has talked to one woman?
fathers, yes, or even those who are not even married. I mean, I've managed them for prostatic diseases.
So what are the factors that make some people come down with, say, prostate?
So the strongest factor is still genetics, hereditary,
Genetics.
familial history. The moment you have that positive family history of prostatic disease in the family, is very likely that at some point.
So what could such people do to ensure that they don't have prostate problems?
So prostate problems in that context will be, okay, is there cancer or no cancer? If there is no cancer, I mean,
how do
as
we
long
know?
as- yes.
Do I touch it?
No,
Is it something I can touch?
No, it's not something that you can touch. What I'm saying in essence is, it's likely prostate to be enlarged, generally. But
So
that
at
it is
50,
enlarged,
we should be looking for
you
you.
should be looking. Yes.
Are you serious, please?
Put it that way. Because I mean, screening is the key thing to
No,
do.
because a lot of guys are actually of my own age bracket, because I'm there. I've done a bit of this. There's this test you guys say we
Yes,
should
serum
do.
prostatic specific antigen.
Is it
That just
is it
blood
quite
sample.
predictable?
Alone, it may not be.
Okay.
So ideally, when you do your process specific antigen, you should still go ahead and see a doctor, maybe a family medicine person.
What if it is low? Should I still go ahead and
You may
do
still
other
need to
tests?
see a doctor, because that's why alone it is not sufficient. Because if it is doing a digital rectal examination, I mean, sometimes make a lot of difference.
Absolutely.
Yes, especially if
That means just do the rectal examination.
just
You
the
wear
rectal
glove and then examine me.
I'll be able to feel your prostate and be able to decide if we need to go further.
So in the examination you would do, what you're saying is that you can determine the size.
The size, and then there are some
Other-
features
Okay.
for the consistency of that prostate that may give away suggestion or possibly suspicion of cancer of the prostate.
So what you're saying is that a good number of persons we may have lost to cancer of the prostate could have been saved.
Absolutely. Because the important thing is early detection.
Wow.
And then you can offer curative treatment. But unfortunately, many will come with metastatic.
No, but these
disease.
investigations you're talking about is less than 20,000 or 10,000
Less
naira.
than 10,000
I mean, rectal and then the PSA, maybe 5,000 or 10,000 or
naira,
something.
And then you see a urologist. I mean, even the teaching hospital.
In terms
pay
of,
less.
but in terms of traffic to your clinic, how many men do you see come regularly? Can you compare to how women go to see their doctors the way men come?
Well, gynecologists tends to be on the, I mean, you have quite a number of gynecologists. For example, at work now.
Yeah.
I mean, 3 urologists, you probably have, I mean, times
Maybe
three, times 4 of that number.
Could it be that because women take care of their health more and we don't as men? Is it cultural?
Maybe to some extent. In this environment, one would want to say, to a large extent.
Men wants to think that they are
Until things-
strong.
Yes, until things are really out of hand. I mean, I've seen men who will come at the point at which urine is no longer coming again. So you have to put a catheter.
Which means they must have been having some degree of
symptoms.
problem.
Exactly.
Okay, what are these symptoms that show
retention.
that the prostate is having some
Okay,
challenges?
so first, you, at some point you may realize that now you urinate frequently. I mean, ideally you're able to hold that urine for 3-4 hours. You do not have to go to the toilet. But at some point you realize in less than an hour, you just have to go and empty your bladder. Otherwise, if you don't go, it's as if the urine wants to start coming. So we call that frequency. We call that urgency.
Okay.
You wake up more often at night to urinate.
Okay.
We call that nocturia.
Okay.
I mean, these are some of the symptoms of enlarged prostate. But let me put a caveat to it. It does not mean it is enlarged prostate. There are still some other disease conditions that can give rise to these symptoms I've mentioned.
Yeah.
Okay, but if you now realize that your urine, the flow of your urine is not as strong as it used to be, we call that poor urinary stream.
And you know, because I think this is almost natural. When we're young, in the rain or somewhere, we want to wee-wee, and we usually compete on how high that jet.
Yeah, it can go.
So you're saying that,
No, so
you're
that's
saying
just
with age.
By the time you're getting to 50, you realize that sometimes you have to now move closer to the closet, otherwise
So that you don't
want to
keep-
start. Yes.
And not be having trouble with your
Yes.
wife, wetting the edge of the...
Yes. Wetting the edge.
So once there's from the mental health aspect, when you begin to have trouble with your wife concerning wetting the bowl of the bathroom.
Yes,
You may need to see.
You need to see urologist.
So
Or you get to the, or you get to convenience and then you have to wait 5 minutes before you
it
really start coming out. So that's hesitancy.
Wow.
These are some of the symptoms.
What's making it like that? The gland, I think the gland is like compressing a tube or something.
Yes, the urethra, which is a tube that serves as a conduit for urine from the bladder through the penis. The prostate surrounds that urethra.
Okay, so as it gets bigger,
It puts pressure on the urethra.
okay, so
And
that's
so-
what is producing.
The symptoms, we call them lower urinary tract symptoms.
Now, is it possible that the enlargement leads to cancer? Or somebody may not have an enlargement and the prostate is also malignant?
So prostate, when it is enlarged, may either be enlarged and not cancerous, or may be enlarged and then may be cancerous
At the same time?
at the same time.
Wow.
So enlargement
determines
does
that?
not mean
Genetics?
genetics. Hereditary, that's the most important risk factor.
Wow.
That's familiar history, that's the most important risk factor. The other things we talk about, diet, especially animal-based diet. You are more than 60, you still take lots of red meat, you still take lots of alcohol. They are just
Alcohol can be a predisposing factor?
can be,
somehow.
but
Red
again,
meat.
it's not a strong predisposing factor.
But
these
some
are
form of
things
associated factors
yes.
or factors of predisposition they've seen in certain
Yes,
people.
smoking may be a risk factor.
Okay.
One would encourage more of plant-based diet by the time you are getting to this.
But not sexual activity, because some people, we know we have doctors in the pepper soup joints and all over the place
Yes.
who seem to consult and say the more sexually active you are, you can have problem with prostate.
Well, some have made reference to some.
Any
some
literature to
articles.
back that up?
Yes,
Oh,
some have made reference to some articles. But I mean, like you rightly know, sir. I mean, articles have levels of evidence.
Evidences,
So
yes.
I mean, these are not
It can be
studies.
skewed.
These are not studies that have been subjected to randomized control trials.
Absolutely.
Basically, just at level.
At level.
You get 10 people in your institution, and then you follow them up, and then you conclude that regular ejaculation or more than 21 times in a month could reduce the risk of CAP. I mean, so it has not been subjected to.
So as we take our wives for mammography, we should also come to you.
Absolutely. At least do a PSA, see your urologist or a DRE, and then you can take it off from there.
And you know, this
Like I said, that it is enlarged is not a problem.
I tell you.
That it is cancerous is what we want to nip in the bud. And the thing is early detection.
Yeah.
That is what affords being able to cure it.
Okay, so even before we bring it out and take it to the laboratory, we can begin to have an idea that this may be cancerous.
Yes, right from
examination,
yes, clinical diagnosis,
the assay,
the detail examination.
and
We
then
may have that
begin
clinical
to-
diagnosis that this is likely to be cancer. But of course, to confirm cancer, you still need histological diagnosis.
Yeah. Thank you so much.
Which means
Dr.
we take
Dewi.
part of it.
You know, because it's quite enlightening. I mean, because for people of our age bracket, we're still quite worried, you know, about our health. A lot of us are, you know, we've seen uncles who have had issues with their prostate. Lovely uncles see a prostate, and then in another 2, 3, 4 years, they travel abroad, go to the best hospitals. In 4, 5 years, they are dead. And it's quite painful. And, you know, the question is the heart of every man that, excuse me, what can we also do? We run around, we know that of our wives, the breast, the uterus, the cervix, the
cervix.
pap smear, and
Yes,
all
pap
of
smear
that.
for
We
cervix.
get them to do it. And we don't even have much of these promotional programs that is trying to tell us about us men.
Well, I think sometimes it's about choices too as individuals.
Most of us may not just know that there could be some form of programs for us here like that.
Because we make, I mean, repeatedly I've been to Rave FM, for example.
Oh, yeah?
To discuss.
speak about prostate.
Yes.
Yeah,
Yes.
that's
I mean,
nice.
something anchored by the teaching hospital.
Okay.
And I've spoken about.
So what's your business about the kidney, since you're not a nephrologist and the urinary tract?
Yeah, so the kidney generally too, I mean, you can have cancer of any part of the body.
Okay.
So you can have surgical lesions in the kidney. There may be kidney cancer. I mean, I've seen
So
a
you're
couple
going to
this
cut,
year.
you're going to cut a part of the kidney?
We oftentimes,
Or the total
many oftentimes, that's partial nephrectomy. That's a partial thing. But many of the times, the tumor will be so big in that kidney has to come out. The entire kidney has to come out. But the beautiful thing is the other kidney is there. That would suffice to keep that person living a normal life.
Any factor that predisposes, as usual?
Smoking,
not strong.
for example, genetics,
Smoking, genetics.
again, hereditary aspect of it, smoking.
So beyond the kidney, we go into the tube. You know, there's this tube that connects
the kidney
from
to the bladder.
yes.
That's the ureter.
The ureter, that,
Yes.
that pipe.
That pipe.
It can have a problem?
Yes, especially stone.
Okay.
I've seen a couple, quite a number of patients also coming down with kidney stones. It's usually more, it's commoner in the, Lagos, Abuja axis, for example. But by virtue of the westernization of our diet.
Oh, okay.
Because
So
generally
you're
it's
saying-
commoner amongst Caucasians. So it's Western diet that predisposes to stone. We are in the tropics. We don't take lots of water. Stone disease is very common in the north, for example. I mean, quite common in the north.
Where people don't take water.
Yes, and because of the weather too. But we are seeing quite a number of them around here.
Is that why some people tell us that when you wake up in the morning, you should take like 2 or 3 bottles of water or something? Maybe to
water,
oil.
Yes, water
is just good.
Water helps.
I think it helps. It looks like the kidney looks like the radiator of the car or something.
Yes.
That helps. That needs to be continuously, water flowing. So that it flushes whatever.
Yes. Because when those things aggregate, the waste aggregate, that's
what do you do to the stone? You're going to put your blade there?
Yes. We put the
and bring the stone out.
We bring the stone out. We crush the stone sometimes. There are endoscopic procedures. We can crush the stone without making a cut on your body.
Yeah.
Without making any cut on your body. You can use endoscopic, some instruments going through the penis down to the kidney and blast the stone.
Wow.
Without having to make any cut on the body.
Viewers at home, this is exciting. Even me as a doctor, I'm learning a lot from my consultant urologist that some of these stones can be, you can blast it. So let's go on a short break, viewers, as we take a short break, then we'll come back after some time. Thank you. Yes, viewers, you're welcome to the other segment of our program. I have with me Dr. Ojewi Olufemi, consultant urologist at Union Teaching Hospital. Is taking us on, issues that has to do with the urinary tract, generally for male and female, and of course the genital tract of men. And here we're talking about, I think the last one we're talking about is the stones, how you can blast it.
Yes.
So it's not all the time you have to put your blade and bring it out.
No.
Okay.
No, in fact, I mean, even here in Nigeria, I mean, it's quite rare that you have to put your blade to.
So you put a scope or something through the penis and then you blast
if it's in the bladder, you blast it in the bladder. If it's in that pipe that connects the kidney to the bladder, that's ureter. You get into that.
So why do we run abroad for all these things? I mean, these are things we can do. I think our government just needs to recognize that we have expertise here and make instruments. Because I think you need to guide where that stone is with some form of ultrasonographic machine to know exactly
where it is.
Where that is. Yes. Somebody was asking about pod on the scrotal sac?
That's a ball. That's the testicles. If you have testicles, does it automatically mean that you can achieve conception with the woman?
Yes.
It's not automatic.
Okay. Are there some things? Do you take biopsy of the testicles?
No, the testicles may be there and may not be working. So the question is that individual needs to be evaluated to determine if that's
what could make somebody, I have 2 testicles and doctors are telling me I can't impregnate, I have erection. What could happen to my testicles?
Could have suffered assault.
Okay, maybe injury.
That could have been injury.
Maybe some infection too.
Yes, the testicles may be producing semen, and then there's a problem with sperm, and then there's a problem with delivery. There's blockage of the delivery. After it has, through the path through which urine comes out.
Where do you want to call generally gonorrhea or something?
So it's the path cannot. Yes, it's the same path that the semen comes out from. So if there's a blockage along that path, then there could be a problem with delivery of the semen of the sperm cells.
What are some of the symptoms that can actually lead to this, that can point to the fact that there's a problem, either with the pipe or the testicles?
Recurrent sexually transmitted diseases.
So these sexually transmitted diseases should be properly treated?
Properly managed. Unfortunately, sometimes people would prefer to go to stand 5. I mean, with due respect to, I mean, everyone. By me, this is just the way it is in this country.
Yeah.
So sometimes people want that magic, and then you want to go to somewhere where they will give you.
So if somebody has an XTD, which is sexually transmitted disease, as a male, even as females, because I think we wouldn't be able to quote exactly the percentage of the contribution of these sexually transmitted diseases to infertility, but I think it's quite high.
It's quite high, both in males
because
and
both,
females. Pelvic inflammatory disease.
Yeah.
In males, it will block all the tubes.
And
can
men
also damage the testicles.
Yeah, men keep living in the denial that once we know in Africa here, the proof of manhood is erection, isn't it? But do you also deal with erectile dysfunction? Absolutely. When somebody is claiming that
there, but it's not, the erection is not coming.
Why would that happen, sir?
So many factors again. I mean, and that's also on the rise.
It's on the rise,
yes. The stress.
From your practice, what have you found out that is responsible for this?
The age group, when we see it in the middle age to the elderly, so many organic comorbidities that could explain
a lot of people that are diabetic.
Hypertension. Yeah. There's this Peyronie's disease, what we call Peyronie's disease, that also seems to be seen in recent times.
Okay, what's that?
I mean, recurrent trauma to the penis can cause some hardness within that penis, and the blood will not be able to flow well to make it erect. I mean,
and then I think medications too.
Yes,
a good number. Is it true that a good number of persons that are on antihypertensives may have some form of erectile problem?
Yes, some antihypertensives predisposes to erectile dysfunction. And like you rightly know and taught me too. I mean, some antipsychotics, some antipsychotics can also predispose to some form of erectile dysfunction.
But we also feel that a lot of psychological issues, maybe for the younger age group,
for the younger age group, so much pressure,
house rent, school fees.
So the women needs to manage.
Okay, the women are the ones that are supposed to manage erectile dysfunction.
No. They need to manage those stressful conditions.
The women?
Yes.
They are men?
I mean, if the guy is not bringing home, I mean, sometimes it's a transient thing. You want to go to stressful condition, probably at your workplace. Your boss is putting some pressure on you, or you probably lost your job.
You don't
sometimes
remember
the reaction of the woman can either determine how soon. I mean, I'm sure a guy.
Yes, of course, because in our culture here, they also the proof of manhood. One man said he saw his uncle around Olaya sometimes, was trying to buy these local herbs to be able to. He's 65, and he was wondering why does the man is it part of our culture, or I don't know. How do you explain?
Sometimes at that age, there's an association between prostatic diseases and then erectile dysfunction.
Oh, really?
So that may just be a manifestation of prostatic disease.
So not necessarily because they have to go and get a stimulant somewhere, some kind of concussion.
Not necessarily.
Because sometimes a lot of these retirees,
prostatic problem can solve the erectile problem.
Wow.
They are interwoven.
Oh, okay. So it's cool. Erectile dysfunction could actually be signal that there's a prostate problem, apart from the psychological ones.
Apart from the psychological ones.
Okay, so what can people do when they have this? Can they come?
Yes.
So and say, please, doctor, I have erectile dysfunction. And I want to see a doctor.
The important thing is to be able to arrive at a diagnosis.
What percentage of clients have you ever had say I have erectile and they come to you?
There's no clinic that won't have a patient with erectile dysfunction. And we run 2 clinics in a week in the teaching hospital.
They come?
In the teaching hospital.
Do they come alone or with their wives?
Talk of them. I mean, they usually
come alone.
I've seen just a few coming with their wives. But men would rather, men will be men. Your
ego and then the sense of manhood that I'm in charge of my life.
You see a man come with the wife. There have been cases I've seen that it's actually the women that will prompt her, doctor, please, I need you to see my husband. He has this problem. I hold such women in that regard.
Supportive, because what you have been saying is that women too are very therapeutic in the management of erectile dysfunction.
Absolutely.
Yeah, because once you are having erectile dysfunction at home, a woman feels maybe you have a mistress outside.
That's a possibility.
Or infidelity is a sign of infidelity, and that women should also please. I think our women at home, I think we need to take this into consideration. That when your husband has erectile dysfunction, it's better we get them to see doctors rather than persecute them or think it's because of infidelity. Thank you for stressing that point, doctor.
Thank you.
Now, I've had people talk about problems with the bladder. What are some of the problems with the bladder?
Okay, so bladder, you can have stone in the bladder.
Oh, the stone coming from the pipes, from the ureter. Okay.
And then that can block that path through which urine comes out from.
Wow.
So there can be stone in the bladder, but more commonly there can be tumor in the bladder. There can be tumor in the bladder, especially if you are exposed to. I mean, you've worked in barefooted streams at childhood. You've been exposed to schistosomiasis,
Okay.
which is something that is relatively common in our part of.
Schistosomiasis can
is
actually
a risk factor for bladder
That's
cancer
correct.
when it is not properly managed.
Wow.
Later on, they can come down with bladder
Which
cancer.
one is this elephantiasis?
That's a lymphatic thing that blocks the lymphatics and then swollen scrotum, swollen.
But it gets to the scrotum.
Yes,
Can it also cause infertility?
may lead to erectile dysfunction to start.
Erectile
And
dysfunction.
at least you need erection in the context of conception by natural means. You need erection to be able to.
But what happens? Why some people have to keep it for so long that it becomes that big? Is it the pathology in itself, or it is because of ignorance?
Sometimes ignorance, and then sometimes associating all these conditions with so many other things that are not there.
Okay,
It's
like an
something
attack.
somewhere that is responsible for this, and rather than seek for medical help. you
So
keep
for people
looking
who have growth in the bladder, what are the symptoms they come up with?
it's still the
how
lower
they-
urinary tract symptoms,
Okay.
but most importantly, they can have blood in their urine. We call that hematuria. So when there's blood in the urine, that's a symptom that needs to be properly evaluated to be sure that. I mean, something about blood in the urine is whether you, at the initial phase, whether you take which is what some of our colleagues do, they place on antibiotics. Whether you place on antibiotics or not, it will become clear at some point. So it's not like the antibiotics is what has done the miracle. The point is, at some point, it becomes clear and then becomes blood stain again. So the earlier such a patient is properly evaluated, the better. So that when you see that growth in the bladder, you can go after it and cut it off.
Quickly.
Again, you can't make a cut on the body for that kind of procedure.
Okay.
You have to go
You
into
go
the penis,
inside.
an endoscopic procedure
Oh,
to be able
yeah.
to take care of bladder tumor.
That's fantastic. Thank you, Dr. Ojewi.
Thank you.
How about the issue of, there's this thing that was coming to my mind about, I think it's about erectile dysfunction. Maybe as we go on, the idea will come again. So what do you generally advise our men, when they can come to see you for some of this evaluation?
So again, men needs to open up. Sometimes you are quite invasive with respect to some of our
Health
complaints. Yes,
conditions, yeah.
we are quite invasive. You don't want to say it the way it is. I mean, and many of the urologists you are going to meet, they are males. There are few female urologists actually, but many that one will probably meet in one's lifetime will be males. So you should be able to open up and
then
explain
talk, yeah.
exactly what the problems are, so that we can arrive at a clinical diagnosis, request for the necessary investigations,
Yeah.
and be able to clinch it early enough.
That's interesting. So your area of specialty deals with the kidney. So what could be tumor be in the kidney? Which part of the kidney?
Any part of the kidney.
Any part? And it just
It's commoner in the upper pole of the kidney. But by the time it occupies the upper pole, it eventually becomes so big that it compresses the remnant normal kidney tissue. And then what we have to do is to remove the entire kidney.
Wow, that's interesting. So for those who possibly, in terms of surgery, I remember as a student, people used to be scared of prostatectomy. I remember, I think you have helped me to manage the father of my friend, a professor of medicine in the US, who was about 85 when you operated him, and he was so scared. He said, hey, Deoye, please, I need to move my father to Lagos, or I want to get him to America and all that. And I said, I have a young man here who will help you put it out, Thank God he didn't ask for your photograph. So I said, this young man, 85, people are scared of prostatectomy. And I remember as a student, there used to be this kind of prostatectomy they used to do, where they would put some pipes, some IV fluid. It's always came. Are they still doing that now?
Things have changed over time.
Okay.
In fact, you can, most prostatectomies that we do now, number one, you do not have to do this putting fluid because you're able to secure hemostasis. It's about blood. Prostate bleeds a lot. So by being able to ensure that you do the right technique to ensure that you secure hemostasis right there.
Okay.
So that post-operatively you can go to
So what you're saying is that there are better surgical procedures that can, even in Nigeria here, even in Osogbo here.
We are not talking about Nigeria, we're talking about Osogbo here.
Okay, yes.
I mean, so you don't even have to make a cut on the body. Again, we call that's a minimally invasive procedure. We call it
The one you put the pipe,
just put
and then
the scope,
resect.
and then cut. Next day, patient can go.
Dr. Jerry, it seems like we should be here forever. So, but time is not our friend. Viewers, I think we need to put a stop to the program now because of time. We still expect you some other time. I mean, next week by God's grace. Dr. Jerry, I'm very happy to have you here. I deeply appreciate your knowledge and your expertise.
It's a privilege, sir, to sit with my teacher and going this program.
Yes, we pray that God will continue to prosper you and then increase your wisdom.
Amen, sir.
Thank you so much.
Thank you very much, sir.
Thank you.